call the meeting to order. It is 7:30 p.m. right on the dot. And I believe for attendance, Candace is here. And Laurel and Ruth. And I know Cindy's here. And we will open up for public participation. Is there anybody on that is here for public participation?
Yep, here's David. He's coming on now.
Okay, so could you state your name and address, David, to the board, please?
Yep. Can you hear me okay?
Yes, perfect.
Okay. David Dubay. I'm at 59 Merriam Street in Wakefield. But I'm here on behalf of Wakefield Soccer Association. I'm the acting president and had a few questions in or your stance as a group as far as our interaction as we move forward with our fall 2020 season.
Okay. If you would go ahead and ask your questions, David.
Okay. Thank you. Thank you all very much for having me. What I would start out by saying, and I don't want to take up too much of your time, but we've been very actively involved since COVID-19 with Massachusetts State Soccer Association, who's sort of like our governing body, and their directives to us as a local organization have been, if we have any sorts of COVID-related incidences where either a player or a coach presents with or tests positive for COVID-19, our action is to notify our local Board of Health. And so I wanted to sort of open up the dialogue as far as how do we go about doing that? What sort of reporting would you like from us? And how do we interact with that situation?
So what happens is that we only want to know if somebody is diagnosed with a positive test, not somebody who has symptoms, but somebody who's positive. If they live in Melrose or Wakefield, which presumably they will if you're on your soccer group, we will be notified. We might have already been notified before you're notified, so you don't really have to notify us. But we welcome you to notify us because sometimes you'll know before we do and we can start the process quicker. But anybody who's positive who lives in Wakefield and Melrose, because we're a joint health department, we know about. And all you have to do is call the health department.
Okay. Okay. So so a question that's sort of come up is, I think you may have answered that, and thank you for that. But I'll ask anyhow, so I can kind of put a period to that. Is so if in the event one of our players calls and says that they threw up in the middle of the night, we're dealing with young children, what should our action be with that player? If you give a recommendation on what we should do in that event, should they attend that next training session? Should they sit out? Is there any reporting that we need to do? Things like that.
There's no reporting they have to do. I would follow what we do for school, which is nobody comes to school if they've thrown up or have a fever within 24 hours. If they're concerned about COVID, then they should go get tested. Kids get sick, on a lot of things besides COVID.
Yeah, and just so you guys know as well, so I work over at the Winchester Hospital. We're now part of BI and all that. So, we've been in the trenches now with COVID, just, like you guys have as well. So, I sort of have that, hospital sort of environment that I'm in. So I kind of see it on a different level, than the remainder of the board. But just wanted to be sure that, we don't overreact and that we don't underreact, as an organization with our members. At work, what we would do is we would just sort of wait to see if those symptoms are persistent, and if they're in alignment with any of the CDC, guided symptoms. But okay, so you don't need us to report anything to you unless it's a known positive COVID that's come to our attention. Okay.
And then we would welcome you to call us because sometimes the electronic surveillance system is a little slow and it may not get in for 24 hours. So, call us because we can start earlier. But let me take that a step further. If you've been following the guidance and doing drills and skills and everybody's 6 feet away from each other, then even with a positive kid, there's nothing else you need to do. It's kind of the whole point of the social distancing.
Yeah, and that's been the one good thing, at least from the Massachusetts State Soccer Association. They've really gone above and beyond with all of their guidelines and guidance. So it's a very well mapped out structure that we're following.
Mhm.
And then what also has happened is that we're not traveling outside of Wakefield for any games or activities. So all of the activities that we do will just be within the town of Wakefield. And
You're not playing teams from any other town?
no.
Okay, so you're good.
And so if we did play a team from an out of town, does that create any conflicts from your office?
I would have to reread because there's so many different things out there. I'd have to look. Are you considered moderate? I think you're moderate risk, not high risk.
That's correct. We're moderate risk. Yeah.
So I believe you're allowed games, but not tournaments.
Correct. Yep. Correct.
So, but again, you do the 6 feet apart.
Yeah.
There's no consequence.
Yeah. Okay. Yeah. And we're not going to take that step. We're going to wait and see how things map out a little bit. Anyhow, we don't feel a desire to play against other teams from other towns, so we're not going to be taking that step anyhow. But I just figured I'd ask if you had any reservations about that.
Nope.
Okay. If there's nothing else that you guys can offer or any other information, again, thank you so much for your time. I appreciate it.
Thank you, David, for asking.
If you have any questions, just either email me or give me a ring.
Okay. Okay. Great. Thank you. So I'll be cutting out now. Is that correct?
If you hang up, if you leave the meeting, you will be, yeah.
Okay.
Yeah.
All right. Thank you very
Thank you.
much.
Have a nice season.
Thanks.
Okay. Bye, everybody.
You're welcome. Thank you.
Bye. Is there anyone else for public participation?
I see none on the participants list.
Yeah, I don't see anybody. Okay, so we will close the public participation. It's 7:38.
No, you don't have
Okay.
to put that in the minutes, the time.
Anyways,
Okay, we will start with the approval of I think everybody has them, the minutes. I think the first one was for July 15th.
yep. So we were just discussing, Ruth, both Elaine, I don't know, Candace, if you had the same issue when I went to print these. I don't know if the health director's report got entered into it a different way, but the entire document didn't print on my end, but I was able to read it and I can pull it up, but I had no issues.
What do you mean it didn't print? Tell me, what do you
It
mean?
was so funny. So here, I'll show you.
It's just
Yeah.
It stops when you go to print it, it stops after the reorganization of the Board of Health. So you can see on it as a document that it's complete, but for some reason when it prints, it wouldn't completely print. Here, I can share it here.
I have no idea. I mean, it's just a regular Word file that I
Yeah,
emailed you the way I always email it.
Yeah, mine ended up coming out like in 3 different pieces of paper, but not everything. It's the first time I've ever had a problem with Ruth's stuff. Hers always comes out perfect.
Well, you know what? If it's IT related,
Call them tomorrow.
I have no answers.
Well,
Yeah.
this copy didn't have the fancy letterhead, did it? Let me look.
No, not on the notes. No, it didn't. But on her, I believe she had it on her director's report. It did have the
Yeah.
Board of Health thing,
It did.
but not on the minutes of the meeting. No.
The July minutes or the
Yeah,
August minutes?
The July minutes. So
Oh,
July.
but I
and
think
the
you told us at the last meeting and so we put it on the August minutes.
okay.
Okay.
But Cindy can put it on the July.
Yeah,
minutes. That's
after
no big deal.
gets approved, it needs to be pretty. Okay.
Is there, any comments or, corrections to be done for the July 15th meeting?
No, I think it looks good.
Okay,
I-
okay. All right, can you make a, go ahead.
I'll make a
Laura.
motion to accept the July 15th, 2020 minutes as written.
I'll second that motion.
Okay, all in favor? Candace?
Aye.
Aye. Laurel?
Aye.
And Silver, I all agree. Any other comments? Okay, so the July 15th minutes of the meeting are accepted. We will now move on to the minutes of the meeting from August 12th.
These ones looked very pretty and they printed correctly. And
Aye.
No idea.
I did not see, I did not have any issues.
It's on the August 12th. Candace, did you see anything?
No, I think the August 12th looks good too.
Okay, somebody want to make a motion?
I can make a motion to accept
Okay.
the minutes for August 12th as written.
Second is Laurel.
Oh, sorry. Yes, I'm telling you, these wobbly, I second.
Okay, all in favor?
Aye, Gorville.
Okay, aye.
Linehan, aye.
Okay, Silver eye. Okay, so moved. Those minutes are accepted. We will now move on to the next thing on the agenda is the review of the school committee's COVID-19 policies. Ruth, I imagine.
Yeah, Doug had wanted to be on the meeting tonight, and Cindy forwarded the link again to him. So I don't know if you want to wait a few minutes to see if
Yep.
he's on or not. So why don't
Do
we
you-
do other
wanna-
stuff and then come back, just in case he's able to get on?
Would you, do you want to take out of order and do your health director's report, or,
Yeah, sure.
okay, we can take that out of order?
Well, I gave you the report, so why don't you, if there's questions or you want more information about something, I'm working with Jen about putting the graph up on, in the website in a way that I can update it every day. I guess there's a different program, again, IT, I don't know, but I'm working with her so that we can do that, so that we'll have a, a daily count, but in a line chart.
Mhm.
Because I think that would be nice. And I didn't have time today to look at 4 o'clock. Did anybody check the website to see what color we are? Because they updated it 4 o'clock on Wednesdays, but I've been slammed.
No,
We were white, so
Now, is the color white or gray? One of the inspectors told me they changed it to
it
gray.
looks gray.
it looks great.
It looks gray on the chart, but I think what they mean is white. Like they
Oh.
use the words white, yellow, green, and red,
Okay.
but if you look at it on the map, it looks gray. No idea.
Should I try to pull it up now?
I got it. I got it.
Oh,
You
good.
got it? I don't think we changed.
Just give me a sec. Let me see here. Wakefield is gray.
Yay!
Still there.
2 weeks in a row. So,
We are actually the only one that's gray. Reading, Stoneham, and Melrose are all green, and Linfield, Saugus, and Peabody are yellow. So we're sort of like an outlier in our town.
and there was great rejoicing.
There is.
Anything about COVID that you have questions about? Most of the COVID stuff right now is with the schools and getting them open and sport.
Ruth, I emailed you a question about the flu clinics, but this lady from town had emailed me, and I know it's not important at this stage. If we were going to think about a plan for Halloween with kids and, I don't know, going door to door, like maybe just something to kind of put out there, because I bet people are going to ask.
Yeah.
Yeah, I guess that's a question for me to ask Steve about, because they kind of do things as a, community-wide, going downtown with stores. So I can ask Steve. I don't know of any other, it hasn't come up in any of my meetings, so I haven't heard of any other health departments giving advice about Halloween.
Mm.
You know my stand on fomites. I don't care about where
No.
people have touched, quite frankly.
Not so
Mhm.
worried about it. Yeah.
So it's not something I would recommend
Mhm.
to spend a lot of time and energy about wiping down wrapped candy.
Yeah.
So,
Yeah, but it will come to us. So I imagine that this comes, we'll be on the heels of, we got to get over school opening, let that settle
Right.
down, and it will be the
Yeah.
next hot issue. So,
well,
Um,
Halloween is all about masks anyway. So if you're walking up to somebody's door with a mask on and you have a mask on and they hand you.
Everybody will have
long-
the candy giver
Yeah.
and the candy taker.
That's right. You have that big long grabber. Should be fine. We'll make a game
I
out
just
of it.
don't see what the risk is.
Well, I also think that people will make their own decisions about it, but I am a little worried that they'll look to us. So
Mhm. I think they'll just ask for a little bit of guidance. Like you say, Ruth, everyone's going to have a mask on and some do remove them. Let's face it, some costumes are beautiful, but I think maybe more so, I think people are thinking of crowds. Like neighborhoods walk together. I mean, my neighborhood's changed, so we don't have many children in the neighborhood, so we only get like 3 people. So
Yeah, I don't see that anymore. I mean, that
Yeah.
was how it was, but I don't see groups of families walking down the street Halloweening anymore.
yeah, we don't have many in our
Way
neighborhood. I don't
more
know, Candace, you
Halloween
may.
parties where they get
Well,
together.
Madison Ave, which is kind of right down the hill from you,
Yeah.
Elaine, is like
Yeah.
a big party.
That always was. They had the best candy.
Yeah. Yeah, and we do get groups. There's usually a fair amount of adults and kids kind of walking around. But I didn't even think of the downtown. That could be a place where crowds could gather if the businesses are going to be handing out.
They usually do the stores, plus they usually do the pumpkins. Isn't it the art department usually decorates the pumpkins and puts them
Yeah.
out on the library?
yeah.
Oh,
So-
yeah. That's nice.
So that might be something that, I don't know what they're going to do that this year or whatnot, but I guess it's something we'll have to wait. We'll get school open first and get them in to learn.
Mhm.
Yeah,
see.
put it on the not right now, but maybe soon list.
Okay.
Well, we have a second meeting in September, correct? Well, and we'll have, in our October meeting is before then. So
And I can, I'm on DPH calls 3 days a week. It hasn't come up, so I can also just see if anybody else
Not
is talking about it.
Mhm.
okay. So
So I can talk about flu if there's no more COVID.
Yep.
Okay.
So, so let's see, we ordered 7,700 doses of regular and 60 high dose, which is more than what we used last year because we're anticipating a higher request. So next week, we should be getting 180 regular and the 60 high dose. And we don't have a date yet on the other part. But Melrose is getting 600 next week. So we'll be fine. So what we're looking at right now is scheduling a drive-through clinic. Karen and I have been talking about the pros, the cons, but there's 2 issues if we do it like we normally do. Number one, we're not supposed to have more than 25 people inside at one time. And I brought this up at a meeting earlier this week with the state to see are they going to have an exemption for flu clinics? Because having 15 patients at a time at a flu clinic is, not very efficient. The other issue is if we have it in a building like we normally do in a school, then we have to clean the whole school before school opens again. So with all that being said, we thought this would be a good year to try the drive-through. We don't have to worry about the cleaning. We don't have to worry about total numbers. We'll have practice drive-through testing on Tuesday when we're doing the teacher testing. So, we can tweak it if we need to. And so we're looking at Saturday, October 2nd, and doing Melrose on Sunday, October 3rd. I just need to clear that there aren't games going on at the fields that day.
Yeah.
And I did reach out to Dan McGrath, and I think what he said was to give him a date and then he would look at a particular date. So
It's funny. So we just had Dave Dubay on the call. He could have looked at his schedule right then. He's the soccer commissioner.
Anyway,
yeah.
I mean, we
So
could
your
do
thought then is to do it like,
Saturday's good. Yeah.
yeah, I mean, yeah. But your thought is to do it like we did the mask.
well, not at the Galvin, no, doing it at the high school.
Oh,
That's where we're doing the teacher testing next week.
okay.
At the high school.
Mhm.
So
Ruth, I sent you another set of,
Yep, I saw 'em.
did you get that? It's a little bit better than what I had sent you last week. Maybe it'll help.
Yep, thanks. So, I mean, I would have done 2 Saturdays, but the next Saturday is not Labor Day weekend,
Columbus or whatever day. we wanna
Columbus,
call that.
yeah.
Columbus Day weekend. So we thought we would do one on Saturday, one on Sunday, and see how much we use at that point.
And then invite each community to go to each other's if that's okay, or?
Oh, yeah,
Yeah.
definitely.
Mhm.
So, and then the only, I think the only senior living that we go to is Harts Hill. So we'll do that again with the high dose at Harts Hill. And we'll have both vaccines at the big clinic. And then we're still waiting on the state about getting state vaccine to do kids. And once we get an answer from them, assuming it's yes, then we will set up some community family-based clinics where the whole family can come at once, and that way parents don't have to bring their kids one place and then they get vaccinated somewhere else, and just to try to make it easier for people. I know Dr. Branchero has said there's no way he can immunize his entire pediatric practice.
That's good input. I
well-
was just wondering what we were getting for feedback from practices. So
The
that's great.
practices I've talked to have said they need help.
Yep.
Then the state says that 80% of Massachusetts children were vaccinated last year for flu.
Wow.
So
That's true.
how those two things do not sync, but whatever.
Well, it does think though that that office protocol is so spread out now that they're really so conscious of crowd control. So I think that's maybe the pediatric practice pushback, is that the actual in-office protocols are really constrained. There's
He didn't elaborate. He just said,
Yeah.
He would certainly need help.
Mhm.
I hate to see kids getting vaccinated at pharmacies by pharmacists and
I
not
know.
nurses.
Yeah.
So I do feel like there's a need and I would like to do it. We just need the vaccine from the state.
Are we
Bring it
prepared?
up at every single call and berate them. So hopefully they'll come up with something soon.
Are we prepared to offer a pediatric vaccine at the farmer's market with our own supply? It's the same.
We can't, well, we can, but we can't get reimbursed for it.
Mm.
Oh, okay.
That's the issue. Because the state has it for free, the insurance companies won't pay us for the vaccine.
Ugh.
So that's
Let's
the
hope that,
problem.
let's hope the state gives us an answer before the 26th, because we are going to be asked that question.
Absolutely.
Yeah.
But they better give it to us by the 26th.
Yeah.
I'm sure they're tired of hearing about it 3 days a week. So,
I'll drive to Jamaica Plain and get it for you if you want, if it's there. Or
pardon me?
is it in JP or do you know where the
It's not-
vaccine?
no, the issue is process.
Yeah.
Normally, a town that wants additional vaccine, it's always based on what you used last year.
Oh, okay.
And we only get vaccine to immunize the SEAM kids.
Right.
So that's not a lot. So the normal process is if you want additional vaccine, that you have to use what you've got, and then they'll give you a little more, and then you use what that up, and then they'll give you a little more, blah, blah, blah. And obviously this year is completely different. And a lot of us who don't normally do peds are saying, we want to do pediatric clinics. We want to immunize quantities of kids. We need several hundred doses of vaccine and we need it up front.
Yeah.
You need a different process.
Yeah, I gotcha.
So
Okay.
they're not quick at changing processes.
And they're stingy sometimes with their vaccine. And in all fairness, because you have to remember, like you say, Ruth, there's so many communities that do vaccinate their children in the school. If you find like, and you talk about the 80%, that is about accurate, because if you live in a community that's very, has a lot of different medical facilities, like such as we're in Everett, we had Mass General, we had Cambridge Health Alliance, we had East Boston, we had so many places that you would be amazed how many went and got a flu vaccine. It was very, very fun, but they had the resources. But now, you know, you can't pull that. And I do agree with Laurel. I think it's the fact that they don't want that many people. They can't have that many people in their office. So where are they going to go and what are they going to do?
Well, I mean, the state doesn't want a lot. I mean, if you remember years ago, they gave out a lot of vaccine.
Yep.
And people didn't use it all, but they didn't give it back till the end of the season.
Yeah.
So a lot of it went to waste. But the last several years, people have been good about saying, we have 60 doses left. And then they reallocate it to another city, and we don't even have to give it back to the state to have it come out again. You know, the other city can come and just pick it up. So the issue isn't availability. They say they have and will have plenty of vaccine. They just need to come up with a process. I just don't see what the big deal is about coming up with a different process of saying, here, Wakefield, here's 400 doses. You have 4,000 kids in your school system. We'll give you 10%. Give us 400 doses and we'll see how it goes. You know, it's not that big a deal, but it is to them. But as soon as that part's straightened out, we'll move on.
Sounds good.
And so we are scheduled for the farmer's market 9 to 1. Laurel is going to be there and Karen. So Karen and Laurel will be there. Laurel, I think, has a student.
Karen has a student. I
Okay,
can get
Karen has a student.
can find a student.
Laurel is Laurel. So Jen made the form fillable. So I just need to, I just want to put the date on it so that people who will give that form to the farmer's market. That way, people can print it out, you know, having it already filled out. If they don't, they can fill it out like they always do
Mhm.
there. Before I forget, Cindy, who just disappeared.
Yeah.
Cindy, we're going to be getting additional money to help us pay for flu clinic supplies this year.
Yes,
So can you order 20 clipboards for us?
they're in my cart.
Hmm?
I placed them in my cart, my WB Mason cart already.
Oh, awesome. Thank you. So anyway, so we're all set. We'll have, 2 lines going at the farmer's market. The farmer's market is advertising it. And we hope we have good weather. What else about flu?
I don't know. So we
That's
just
it.
don't, we just really haven't hammered out, like usually we have our schedule by about now. So we're just trying
Yeah,
to
but
figure it out.
it's going to be different this year.
Yeah.
And
I agree.
I don't want to get burned with the vaccine. So I hate to this year set something up in August, not knowing when the vaccine is.
Mhm.
But we do have confirmation about that first shipment next week.
Mhm.
Mhm.
So I know we'll have at least 180. And the schools usually use about 200. So we're going to have to wait until the second shipment comes in. And then as soon as the second shipment comes in, we'll give it to the school nurses to do. And the VOC has asked us to do the VOC this year too.
Boy.
So they do have nurses there. So we're going to say, Karen would be happy to come and do it with one of their nurses so
Yep,
that there's a
I
little bit
agree.
of buy-in there from them.
Yep. I absolutely agree with that.
Yeah. So I want to see what our numbers are from the first big clinic and see, before we do more,
Mhm.
because every time we do it inside is another whole thing.
Yeah.
So we're waiting to hear the ruling about limiting the numbers of people. But, we usually do it at the Galvin and, I don't know, I can't remember their schedule. Was it everybody's off on Wednesdays?
Oh gosh, that's an interesting point. Yes, I think that's
So
true.
isn't that their cleaning day? I know it's
Yeah.
different in Melrose. So,
Yeah.
so what we could do is do it on a Tuesday after school, a Tuesday evening, because they're
Cleaning.
cleaning the school anyway
Yeah.
the next day.
That's a good thought.
Yeah.
Good idea.
Didn't think of that. So we could do that like the middle of October.
All right, that's an interesting.
I'll talk to Karen about that and see if we can get a better idea about when the other vaccine is arriving, because we haven't heard anything. Remember, we ordered from 2 different companies.
Yep.
So purposely, so that if one pooped out on us, we would still have the other. But we can.
Is there any other that's not maybe totally enclosed that we could try? I don't know. I'm just thinking like
A 10.
what about Flo's car wash or something? I mean, we would be we'd have a roof over our heads if they would agree to like give us a couple hours. I don't know.
Mhm.
Or, I mean, just setting up another outdoor clinic in October. I mean, yeah, it would be a little bit colder, but it's likely not going to snow.
No. I mean, we can do that. Let's see how the first one goes and what kind of response we get and how much vaccine we have left. The Shaws in Melrose had a sign up saying that they were already offering a flu clinic there, but I haven't been to the Shaws in Wakefield lately.
They don't have a pharmacy at the Shaws in Wakefield, so how could they?
They don't have one in Melrose either.
So who's sponsoring the flu clinic?
Good question. I have no idea. I didn't ask. I was at Shaw's today, so I just happened to see the sign up today. I mean, we can certainly come up with another site and I am not saying we're not going to do another flu clinic.
So we did the emergency drill for Wakefield a couple of years ago in the Vogue parking lot. And what's nice about that is that's a big stretch.
Yeah.
So that
And it's around.
And,
Yeah.
and it's a nice loop. Like you would never want to do the Shaws in Wakefield because the entrance and exit of that place is a nightmare.
Right.
And, so egress is important, but, we did train
Yep.
for the drill up there. So that might be something
Absolutely.
to
It just
remember.
depends on what's going on there.
Yep.
We're doing the teacher testing at the high school because the school's still in session,
Mhm.
till 2:45 that day. So we really didn't want to be up there. And they're not participating because they've already done it. So,
So are you
but
doing
yes, we have drilled up there and we could certainly do it up there, especially
Mhm.
on a weekend.
Yeah.
As long as there's no sports games going on.
Mhm.
Yeah. Where are you doing it at the high school for the teachers? The front?
So the teachers one is, okay.
Sorry, I just
No,
I'm
no.
curious.
I think they call it the upper parking lot. It's the
Oh, yeah.
parking lot
Yeah.
Across from
with
Landrigan.
outside the admin offices,
Oh,
Mhm.
yes, okay.
not
Okay.
the one where WCAT is, but one up
Yeah,
from
yes, yeah,
Yeah.
yep.
So people will come in Hemlock, drive up. There's a jug handle at Landrigan Field.
Yep.
Mhm.
There'll be a person there. They'll go through the jug handle and around and then
Yeah.
come down Hemlock
Mhm.
Mhm.
and then go in the first entrance.
Yep, and out the second. I got you.
And
Yep.
the
Mhm.
second entrance. And I was over there last Saturday because I was scoping it out I don't use that parking lot. I know the other parking lot well, but not that
Yeah.
one, so I wanted to see it. So Bob and I did a field trip Saturday, and I know I do fun field trips. But it actually was the hazardous waste collection day at the same time.
Oh, God, that's
Oh,
right.
yeah, that's right.
So even though the collection was actually at the parking lot in between Woodville and the high school,
Mhm.
they were queued down Farm Street. Well, actually, they were queued
Dude, on Hemlock.
in the parking lot, not on
Mhm.
the street, in the parking lot in front of the school,
Yep.
high school, and then up Hemlock.
Yep.
So it seems like a system that people are familiar with.
Mhm.
And I have a police detail, just one person, and 3 DPW people to help with traffic control.
But you have a company doing the testing, right?
Yeah, Cataldo's doing the testing and Broad Institute is doing the lab work.
Okay.
And as of this afternoon, there were 60 people signed up, 9 from Melrose, because we already did ours,
Mhm.
and 51 from Wakefield. But that was earlier today, so.
Yep.
And they have till 3 o'clock on Friday to sign up.
Okay.
And the reason we're doing the pre-registration is so Cataldo knows how much staff to have, how much supplies to have. So depending on what the response, we'll have either 2 or 3 stations set up for testing. And with pre-registration, it goes really fast.
Good.
Candace. May I get, not like this, but could you text me your NPI number? We need to have an NPI number for Cataldo. They do the orders and they take responsibility, but they still want a provider and their NPI number. And Laurel said hers is in limbo or something.
Just Google my name and you'll see it. Google Candace
really?
Linehan, NPI. Yeah, it's terrifying.
Okay,
Yeah.
it's not very confidential.
Yeah.
Wow.
No.
So anyway, that's Tuesday, 2 to 7.
Do you need any help?
Yeah, can always use some help if you'd like to. It's right down the street from your house.
I know, I could walk.
You could walk.
I'm sorry, you just said it was what time?
2 to 7.
I'm not
And
gonna
we'll
be.
set up at 1. And then I'm on vacation the rest of the week. Karen will have access to the Broad Institute database because every time we've done one of these, there's a bunch of people who don't get their results and call us.
Mhm.
So that's
So
9/8.
then we look it up and give them their results.
Okay, so September 8th, 1
2
PM setup, 2 to 7. So I'll pop down at some, I'll pop it down at 1 to see how it's going and maybe hang out for a couple hours and once you get going.
Great.
I'll be back later on into Wakefield on Tuesday afternoon late, so I'll text you and see if you need somebody later on in the day. I should be home back in Wakefield maybe around 4. I don't know
Okay,
yet.
text me.
I'm
I'll
hoping.
try to keep
I'm
my phone
hoping.
on my,
Okay.
wear something with pockets.
All right.
Is there anything else in regards to, I don't think so. It was a very nice director's report, Ruth.
Yep, thank you.
Yeah, I agree.
Oh,
But
well, it doesn't have anything to do with the director's report, so I'll wait. Where are we?
all right. Well,
Ah, is
it's
there,
after 8, so it doesn't look like Doug is coming on. So
Yeah.
Doug had asked the board to review 2 policies. I guess I don't know, I think it's called the Mass Association of School Committees came out with like 30 different policies. And the school committee picked 2 that they wanted to do. They are consistent with the state guidelines, but they felt like by adopting it as a policy, it kind of emphasized it, made it local, kind of put an exclamation point on it. So the travel one is fine, and as we've learned, has actually been very effective.
Mhm.
The whole Medford brouhaha happened because they had high school kids who went to Cancun, and when they came back, they didn't want to quarantine for 14 days, so they went to get tested. Of course, unfortunately, they didn't quarantine while they were waiting for their results. 3 of them were positive. They had already been out in the community, and that's how that exploded. But the point being that people are paying attention to doing the testing. So underlying the travel policy, I think, is a really good idea.
Mhm.
I did have some issues with the mask one, but I sent you this afternoon a different one from Newton,
Mhm.
and they had actually reworded the sections that I had issues with.
Yeah.
They must have had the
Yeah.
same issues that I did. So I really liked their wording, and
I can't tell. Does it overall make it shorter? It looks more concise.
it's less confusing. I do believe they use the term healthcare provider instead of physician,
Thank you. One of my pet peeves.
which I pointed out. And I didn't like the whole concept of the principal making a medical decision.
Right.
Mhm.
So I think Newton did a great job, and I don't see any reason to reinvent the wheel. I sent that to Doug this afternoon at the same time as
Mhm.
you, but I think he's been super busy today because I haven't heard back from him, and usually I hear right back from him. So my recommendation is that the board's recommendation would be this alternative wording, which
Mhm.
makes the same point, but I think
Yes.
is better worded.
Do you need a motion for that, guys?
Yeah, you can.
So I make a motion that the Board of Health of Wakefield recommends the newly revised wording as provided by Director Clay, with the exception that, of course, you would change Melrose Department of Health to Wakefield Department of Health.
Mhm.
Yeah, I don't remember who sent it to me, but whoever sent it.
Well, Newton sent it to you, or you told us it was Newton,
Yeah.
and then you changed the wording to Melrose, and now we just need to make sure that.
That's because I was in Melrose, so.
Yeah. I get it. It's just, that's our job to keep that straight, so.
Yeah, no, that.
We need a
that's-
job.
Nope.
Do I have a second?
I will second that motion.
Okay. All in favor? Roll call.
Gorville, aye.
All vote.
Linehan, aye.
And I, Silver eye, no other objections, and so moved. We will take the policy that is worded with the changes from Newton and adopt that for the face coverings. And that will be our recommendation.
We'll see what the school will do about it. Poor Doug.
Oh, you know what? I did have one other little tidbit about COVID.
Uh-huh.
I've been working with the Voc also because they're another school district within Wakefield.
Mhm.
And there's been a lot of discussion about how schools that have kids from multiple communities,
Oh,
including
yeah.
regional
Mhm.
schools, are going to deal with school closures. So DESE
Yeah.
came out with a guideline, a general guideline, and then they came out with very specific information. And they basically gave each school that has like charter schools and VOCs and regional schools, they linked them with a town or city and said, whatever color that city is whatever is your color.
Oh, okay.
So for the VOC is linked with Revere, which of course is red. So
Wow.
if Revere closes their schools, the VOC closes their schools. School.
Wow.
Oh,
So
wow.
they went to the riskiest population, which I guess is a good,
No, I think they did the most number of kids.
sure.
But their top three communities are, I think,
Lynn,
Revere, Chelsea, and Winthrop.
Yeah.
I
Yeah.
think they're all three red anyway, so.
yeah.
Mhm.
Yeah.
um,
What about our private schools like St. Joseph's, and have they asked us for any advice, or do they?
St. Joseph's has not.
Mm,
Um, Can I tell you?
good to know.
Well, they are, I don't know if you're aware, I don't know, Ruth, even if, I think Karen was on the Maven call. There now is going to be a document, we're doing training Friday on Maven, and it's going to be in regards to any school of higher education. And they will have listed all the private colleges, public schools, so that the cities and towns, if they have somebody attending there, they will be able to go on to the websites and find out if, what the story is going on there. They're going to release the training on Friday. It's very confusing. I can't explain it to it because I was talking to another public health nurse and we were saying like, okay, think about a student here in Wakefield. They could go to any school or be remote from any college. So they're all going to be reporting, and it's going to be a lot of with contract traces. An
So,
interesting program, but confusing.
yeah, actually Karen and I were discussing today the college students, because she has 3 college students. And even though they're all out of state, their addresses are, their home addresses in Wakefield.
Right.
Yeah.
I know at least one was South Carolina, and I can't remember where the other ones were. But the kid from South Carolina, the school hadn't given her, no, it wasn't South Carolina was really good about the results and follow-up and all that stuff. But the other 2 colleges, oops, what happened to my,
We can see you.
you can?
Mhm.
Yep.
How come I
You're
can't
there.
see everybody else?
You lost us?
Yeah, you disappeared. Well,
No.
whatever.
You might be on speaker view.
Whatever. The other schools hadn't, and so Karen gave the girl a lot of information and what to do and what quarantine meant and blah 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 blah. So yes, we're already having that issue with college students.
That's a really interesting way to, that could really skew. We've been doing so well.
Yeah, it's
could feel it.
very difficult too. It happened in a couple of other communities. Especially if you have a lot of public employees like police and fire who use the stations as an address rather than a home. So when they were getting reported, they were getting positive reports into the city or town where they had the testing done, where they gave that address, and then you have to go back in. And there were a few. I worked with Karen on a couple of them, and they were very interesting. And the other thing is, if you do have it and it's reported, like if you're admitted to the hospital, if you go to Melrose Wakefield and you have your test and you're negative, it just goes into we're not notified that you're negative. We don't get any reports from anybody like that, but we can go in on the Maven system and look you up by name.
Right.
And we tried it. I tried it for
It does
myself.
work, Karen.
It
We
works. I
had,
did it.
The Revere testing site for some,
Mm.
how do I get you back? Oh, there you are.
We-
Sorry.
Oh,
For some reason, the Revere testing site, when people don't get their test results, they've been referring them to us and saying, call the health department. So I need to call Revere and say, cut it out.
Yeah.
But yes, Karen can look it up in Maven, of course, but you know, we can't be doing that for the stop.
no,
the
we
spread
can't.
site.
We can't be doing that. It's,
No.
at
But
first,
it's
nobody
happened more
thought it
than
worked.
once.
Yeah, it
Now
has.
that
So,
it's happened more than once, I need to call them and say,
yeah.
problem is you
Just-
can't really get through on their phone lines.
Well, I was gonna
Yeah,
say,
it's happening.
is it appropriate to bring that up in the DPH conference calls?
Yeah, I can.
Yeah.
I can.
Because
If I
those
can
are those
get through on the
hotspot
phone,
testing.
I'd rather talk to them directly, but if I can't,
Mhm.
I can
Publicly shame them.
do that.
Yeah.
Yeah. But there's
It is,
there's
'cause-
only one, which is kind of odd.
Yeah.
But if
Yeah,
you
I saw it in,
if you look on the Stop the Spread website, which I did today because I need to get tested on Monday, some of the sites have the phone number and then they have a separate phone number to call for results. But not every site has that other phone number.
Going to Maine, huh?
Yep.
You know, they should know that you're from, Wakefield and Reading and that.
And
our
I'm
roads are
white.
Looking good.
I'm in a white town.
We're in the white- I know. That's why I think we're supposed to pick gray.
Oh,
Yeah.
I wonder if that's why they did it.
I
oh,
think
maybe they think they saw gray.
I'm
Mm.
gray.
we're gray.
Melrose
Ah.
is very light green.
Oh, does that mean you're almost ready? Almost right?
We're almost right.
Wow, that's crazy.
Because our
Like gray.
numbers are very comparable, a little teeny bit more than Wakefield, but not much. So,
Mhm.
but it really doesn't take much to go to green, from gray.
That's okay.
So getting back to the health director's report, also, we're just talking about all these, our grants are in a weird place next year. So
Yeah.
Yes.
Mhm.
that may very well change how things look.
Well, Mass in Motion is probably going to be gone. However, in my spare time, what I'm working on is trying to get our public health coalition,
Yeah.
recognized as a district, because the districts are getting way more resources. And Medford has a Mass in Motion grant,
Mhm.
but they're only giving out half as many next year,
Yeah.
but more money to them.
Oh,
So if we applied as the Mystic Valley
Yeah.
district, that would include 6 towns, and I think we would be in a much better place.
I mean, it's so funny. All of this has just taken such a back, just
mhm.
we're kind of gone underground with this. And I wanted to segue with a thing from Wake Up, but I just wanted to run by you all before I do it. But it is so interesting that, all we do is talk about COVID. In the meanwhile, this mass motion work is really important. The addictions and mental health is more important, but it's all just it's just so odd because,
Well, the work is still being done.
yeah,
It's not as visible.
right.
Mhm.
But
It
what's
is, but
interesting about the new Mass Call grant, which is the MOPSI and SAPSI together,
Oh,
is
Mhm.
that they've removed the opiate part.
yeah,
They're really working on primary prevention
oh,
of, I don't know if you call them primary substances, but alcohol, marijuana, vaping. So it's completely different, and it's half the amount of money.
huh.
So,
Mm.
and Medford's going to want to take that lead.
Well,
Yeah.
I'm embarrassed to say that I started messing up all the differences between primary, secondary, and tertiary prevention in a quiz I had to take. And I'm like, are you kidding me? I do this. I was so aggravated. I was like, that's not primary, that's secondary. So understanding primary before it even happens, then like you're preventing behavior, period.
Yeah,
Mhm.
well, you know, the substance abuse grant will stay with Medford, and then maybe Medford will let one of the rest of us be the lead for the Mass in Motion grant.
And then CADCA is not on here, right?
Tobacco, Melrose is the lead.
Mhm.
Okay. But our grant that pays Catherine Dingra,
Oh, that's a federal grant, that's Wakefield.
okay, right, gotcha. And we have a couple more years on that.
Did anybody, I know Ruth, you also sent a copy from the COVID-19 employee form. Did anybody have any objections, have any questions on that? I thought it was just very straightforward.
Yeah.
Right, okay. All right, is there anything else, any other new business that's arisen? Is anybody
Yeah,
thing? Oh,
Steve.
yes.
here I am, what a surprise. So, so we've had a couple of wake up meetings over the summer. They did a sustainability training, really well done training. And one of the biggest things I learned is that a facilitator really needs a tech agent to run the entire Zoom meeting so that the facilitator can concentrate on what she's doing. And it was pretty slick. It was very professional. We did pay for that. But in the last leadership meeting a few weeks ago, it was brought up by a member who is in, who owns one of the package stores in town, that we had done some preliminary work in the fall with town council, and also Catherine had oriented or done a presentation to town council about best practices in alcohol regs, but of course that's kind of slipped away with other concerns. So kind of to mix it up, I thought that I would I had started a letter. I was just waiting to get some feedback from Liz Parsons, who is the Mystic Valley regional expert about this, because I don't know what was discussed, but I did want to try to revisit with town council and town administrator to at least figure out who amongst the council is actually keeping track of this. I think that, positions have changed, leadership has changed. So I just wanted you all to know that I was going to do that. I'm doing it as a member of Wake Up, but I also have the credentials of being on the Board of Health. So I just want to put that out there, that it's interesting because we don't have a specific commission for alcohol. And so every time something comes up, it's kind of done on an ad hoc basis, and it seems like they were just starting to get there before COVID happened. So the people from Wake Up wanted me to revisit that with them. Does anybody
Are you
have any
talking about like making some recommendations for changes to the local regs?
Eventually, but
Because
at
we
this-
did those a while ago.
right, but making sure that that's still happening. I think that there's some consensus amongst people in the business that they're not clear. Like they just want some clarity, and they want everyone to play by the same rules. And
Clarity on the regulations?
on the regulations and how they're being. So I mean, I'm new to this, so
Are they talking about they got together and came up with some rules that they agreed to follow that aren't part of the local regs, but
So this is separate from that. I
separate
think,
from that. Okay, I didn't know if
but may include it. I think maybe making that more formal. I think that I got the sense that it looked like we had some promising progress and that it stopped, and that where there's some lack of clarity. But again, that's why I was waiting to get some feedback from Liz Parsons before I drafted a letter. And what I would
She's been
do,
on vacation this week and last week, so when she gets back next week, I'm sure she'll get
oh,
into.
Liz is still away?
Liz is away, yeah.
Okay.
So that's why I'm sure she
Oh,
won't.
yeah, no. I knew that she was away, so I was just
Yeah,
waiting.
but
But
she's
I
been away
wanted,
too. It's
you know,
2
she
weeks, so-
just has such a robust understanding of all of this.
Yeah.
But I just wanted to let you know that the Wake Up leadership wanted to visit it. And I think sometimes it's good to refresh who the voice is. So we thought somehow I got voluntold to do this. So I'm working on it. I'll let you know. I'll draft something, but I can't speak to you in between meetings about it. So when Liz gets back and I go back to my notes and try to clarify what it was that we were looking for, I will let you know at the next meeting.
Thank you, Laura, for doing that. Anything else? Nothing else? No? Okay, so,
Hey, at least we talked about something besides COVID today.
I know.
yeah, it's kind of nice. I hate to say it, but.
I agree.
So I'll make a motion to close.
Okay, can we set the date? When is
Oh,
our
yeah,
next
sorry.
meeting?
We said the 16th.
September 16th, right?
Yep. And Steve wants to maintain remote.
Okay, on Zoom.
I have to tell you, oh, thanks, Candace. Between now and then, I'm away 1 week. So I can't imagine I'm gonna have much to say.
Do you want to wait till the,
Do you want to wait till, do you think we're over? I mean, I think we were just worried that so much was going to happen with
Yeah,
the convergence of starting.
school?
I mean, I'm okay on the 23rd. I cannot do it on the 30th. And the 30th is
The
off.
23rd is right before, yeah, would you want to do it that Wednesday, Ruth, instead? Wait an extra week, so if we have a problem from the schools, we
yeah,
would be able to discuss it?
I think it seems like 3 weeks. 4 weeks feels too long, and 2 weeks, it just feels like we just met. So
Yeah.
You're really going to whack the schedule if we do.
I know. Or we can do once a month again, whatever you want. I'm just saying.
Damn
I
it.
think when things are a
Eraser.
little bit more normal, we can do it
Yeah,
once, maybe. you know?
and
What is
I just
normal
don't want to
even
have a
though-
meeting when I haven't been here most of the time.
Yeah, true, just in case something's come up. Okay, so our next meeting will be on Wednesday, September 23rd. Do you want the 7 or a 7:30 time to start? I know, I mean, to me, it doesn't matter, but you people that are out there and about, back to school and working, and
I prefer 7P.
7P, is that okay with you, Candace? I know you got,
We only did
Yeah,
because of my mammogram.
Oh.
No.
Are you okay?
Fine. it was just-
7 o'clock's great for me also.
Okay.
I
7
prefer
o'clock?
7.
so we will continue on Zoom until further notice. And we will meet on the 23rd at 7 p.m. And can we have a motion to adjourn?
I'll make it now. I make a motion to adjourn at 8:34.
I will second that motion.
Okay, all in favor?
Corville, I.
Lenahan, aye.
And Silver, aye. And I thank you all. And let's thank the updates from Zoom and the patience of, I don't know, Cindy,
Grandchildren. Our
to make
technical
sure
support.
that I could be a
The smoothest
host.
meeting we've had so far, technology-wise.
Well,
Well,
done.
I don't know what happened. Well, I think it is because Zoom finally did update everything, and I don't know. My iPad did well tonight, so
Candace
I
did
think
too.
we should take credit for ourselves.
yeah, that we're very smart. Now we know how to do
It's only
this.
taken
so
us 6
smart.
months, but what the
Yeah,
heck?
that's okay.
We're wicked
Next-
smart. Yeah.
Yeah. All right. Thank you, ladies, and have a lovely holiday weekend.
Yep.
Okay.
Good
Thanks.
luck.
Good night, everyone.
All right.
Bye.
Bye-bye.
Bye-bye.